Thank you, everybody, for being here. It's really quite an honor to have you at our press event. You know, last week the governor declared a disaster emergency for the opioid crisis in Pennsylvania. Now, what hadn't been stated is that the General Assembly had actually been working on significant legislation with respect to fighting opioid addiction. The bills on my far left outline legislation that has been introduced by my colleagues, some in the Senate, that has been passed and signed into law. Very effective legislation. 13 meaningful pieces of legislation have begun to address this crisis. It was this good man, Representative Doyle Heffley's resolution, House Resolution 659, which in fact created the Task Force and Advisory Committee on Opioid Prescription Drug Proliferation, which provided many recommendations. They covered prevention, disposal, education, treatment. We created the statewide prescription drug monitoring program, which is being used today. We elevated the crime of drug delivery resulting in death, which is being used by prosecutors against drug dealers and physicians now. We placed limits on the number of opioids that can be prescribed in emergency rooms and to minors. And we established new education standards with regards to saving opioid prescribing in medical schools. There are many more things that have been done and much more to do. Now, here's one of the areas we have not tackled. We have not tackled the problem arising in the workers' compensation system. Many consider that to be one of the areas that pushes people into this opioid abuse. A June 2017 study by the Workers' Compensation Research Institute studied non-surgical claims in 26 states and representing 2/3 of the workers' compensation benefits paid nationwide. Here's the facts. Pennsylvania is the second highest state in the amount of opioids per claim. 87% higher than the median state? Unacceptable. The second highest state in the number of opioid pills per claim at a whopping 258 pills. Unacceptable. And the second highest state in the opioid dosage per pill at 10.2 milligrams. Unacceptable. This good gentleman right here, House Bill 18, enters into the fray. Representative Ryan McKenzie, who has been the champion on this issue and will be speaking next, said there had to be a solution. A Senate bill version followed his version, Senate Bill 936, and it will establish a drug formulary in our worker compensation system. Now, this is a common sense approach, and he's going to explain it. It's been, Ryan, is it true it's been adopted in at least 21 other states? And that includes such states as California, New York, and Washington. Not necessarily conservative or pro-business, but states that care about people, like Pennsylvania should. We use them in nearly every other type of healthcare payment system: Medicare, Medicaid, CHIP, group health insurance. Folks, this is not revolutionary. We have an outstanding array of speakers today, and we're going to lead it off with my colleague, the champion of legislation to restrict opioid usage in the worker compensation system to protect and save lives. Please, a big round of applause for Representative Ryan McKenzie.
Thank you, Mr. Speaker, and good afternoon, everyone. Thank you for joining us as we discuss the opioid epidemic that is ravishing Pennsylvania. We have seen that across the Commonwealth, 13 Pennsylvanians are dying every day due to an opioid or heroin overdose. In 2016, 4,642 Pennsylvanians died from an overdose of opioid drugs. A report from the CDC also found that 27% of people who abuse prescription pain medications received that prescription from a doctor. As Vice Chairman of the Labor and Industry Committee, we have a responsibility to look at what we can do to help workers throughout the entirety of their career, not only when they're starting out and getting educated, or when they're in the workplace, or when they unfortunately lose their job and need unemployment compensation benefits, but also in that unfortunate incident when they get injured on the job and they receive workers' compensation care. We heard the startling statistics that workers' compensation in Pennsylvania is overprescribing opioids, giving out too many pills per claim, and giving them out in dosage amounts that are simply unacceptable, as the speaker said. He referenced the 2016 Workers' Comp Research Institute study, and the statistics are startling. We now see that there is something that needs to be addressed here in Pennsylvania. Medical providers and elected officials across the United States have been implementing a drug formulary to help rein in this problem. A drug formulary is a very commonly and widely accepted tool that is used in lots of healthcare spaces, even right here in Pennsylvania when it comes to Medicaid and opioids that are being prescribed in that system. Recommendations have been made in all kinds of other fields, from sports medicine, geriatrics, OBGYN care, dentistry. This is an accepted practice that is out there. And we need it in workers' comp, but we need to do it statutorily. And that's why we're here on the steps today, calling attention to legislation that will make that change here in Pennsylvania. When Texas implemented their workers' comp drug formulary, they found that they could reduce the opioids being prescribed by 60 to 70%, and at the same time get workers healthy and back to work 34% faster. Those are the outcomes that we want. Get people healthy and back to work, and at the same time have less addictive medications going out the door. So workers' comp, if we implement a drug formulary like that here in Pennsylvania, I am very confident that we will see similar results. And the reason I'm so confident is because we've been seeing that time after time in places like Ohio, New York, and California that were referenced. Everybody, whether you're a Republican or Democrat, sees that this is a solution to a very clear and defined problem that we can take up here in Pennsylvania. I want to thank the speaker for calling attention to this issue. Again, it's something that is ravaging our communities. It is just devastating. When I talk to people in our home communities, even at my home high school, that they are dealing with these problems of overprescription, young people getting addicted to these medications. It's simply unacceptable, and we need to address the issue. This legislation would do it in a responsible fashion, leave that tool in the hands of our healthcare providers, where they can make the best determination for their patient, but now have more evidence at their disposal. And I want to give you, the next speaker here is Joe Pritchard. He's somebody who deals with these issues all the time. He's the CEO of Pinnacle Treatment Centers, and he can shed more light on what he sees in his daily life. Joe? Thank you.
Good afternoon. My name is Joe Pritchard. I'm the Chief Executive Officer for Pinnacle Treatment Centers. We're one of the largest providers of opioid use disorder treatment in the Commonwealth. We have 12 facilities treating over 4,000 individuals every day. First, I want to thank Speaker Turzai for his leadership, Representative McKenzie for taking up this very noble and very important cause in having one more tool in addressing the opioid epidemic in this state and across this country. Every day we treat, as I mentioned, 4,000 individuals whose lives have been devastated through the use of opiates that have now taken control over their lives and everyone around them. With our research, we are showing that at least 45% of those individuals that we treat every day are there as a result of an injury. They were prescribed an opiate, and it took off from there. We support this bill because of the devastation that we see in the communities that we work in and serve in every day. Implementation of a drug formulary as part of the workers' comp system can go a long way to prevent injured workers from even getting to the point of needing treatment that we provide. As President and CEO of Pinnacle Treatment Centers, I have too often witnessed the devastation of prescription drug and opioid abuse in individuals, families, and the communities that we work in. Governor Wolf took up the initiative through the Center of Excellence programs, which we're honored to have 3 of our facilities as part of that, to infuse more resources, money, and support into those communities. So there's a seamless connection between all the providers in the community and treating those who live in that community. As we look at a drug formulary, we must understand that that alone will not help solve this crisis. But in order to be able to effectively address this crisis, we as individuals, either from a provider community that I represent or from insurance communities or employer communities, our goal is to be able to add whatever tool is necessary to prevent this epidemic from growing and devastating our lives and our communities even further. With that, I'd like to introduce our next speaker. John Hanna is the former director of pharmacy in the state of Ohio, who is one of the leading states in addressing this issue of an opioid epidemic and having a formulary.
Thank you, Joe. My name's John Hanna. Prior to my retirement in September of last year, I was the pharmacy director at the Ohio Bureau of Workers' Compensation for about 8 years, from 2009. Prior to joining the Bureau, I'd spent over 30 years in health systems and hospitals as pharmacy director, hospital administrator. The issue that I heard about when I joined the Bureau was that we had opioids, we had injured workers on boatloads of opioids. And my question was, is that a banana boat or an ore carrier or a bass boat? No one knew how much opioids our injured workers were actually taking. So in 2010, we began tracking the opioid loads of our injured workers. That poster over on my right illustrates the outcomes of our work over the last 6-7 years. But one of the first things we did when we started tracking the opioid load of our injured workers was we talked to some addictionologists at colleges in Ohio. And we came up with the fact that they all agreed if an injured worker is taking 12 Vicodin a day for 60 days, they're physically dependent on that drug, and they will experience withdrawal if it's abruptly stopped. In 2011, we had 8,029 injured workers who met that criteria. By June of 2017, we were down to 3,600 who met that criteria. In 2011, we had 50 injured workers who were receiving over 1,000 milligrams opioid load a day. Our top folks were getting 3,000 milligrams. Remember, I told you 60 was what we considered the drug dependence threshold. But we really had to do something about it. A drug formulary is the foundational tool in how you manage drug utilization and improve your drug management. And that's what we had to do. They've been around for over 50 years in hospitals and healthcare systems. We put one in Ohio, and as I said, the outcomes speak for themselves. Our injured workers receiving opioids are down by 50%. As a percentage of our prescription receiving injured workers, folks who are getting prescriptions covered by the Bureau in Ohio, we're below 2002 levels now, currently in 2017. I came over here today simply to say that I really support what Pennsylvania is trying to do. Thank you. And now I'd like to introduce Dr. Jennifer Groshen, CEO of Comprehensive Script Management. Jennifer Dragoon, I'm sorry.
Hi, I'm Dr. Jennifer Dragoon. I'm currently the CEO of Comprehensive Script Management. We are a workers' comp pharmacy benefit management company. I started my career, though, as a practicing physician in Pennsylvania and have spent the last 10 years working on prescription benefits and examining all aspects, and opioid management is one of my areas of passion. I've seen firsthand injured workers get opioids. I've had injured workers die from opioids they were prescribed due to work injuries. And you've heard from a number of speakers some of the impact Opioids, interestingly, are not the most expensive drugs, though, in our workers' compensation system, and really not the only problem we need to focus on. There is rampant use of other drugs off-label, compound medications, topical creams, some of the most expensive drugs in the workers' comp system right now, not FDA approved for their route of administration, not proven to be safe or effective for injured workers, but widely used. And I believe there's an article in the packet you've got that does talk to some of the points about compounding pharmacies and compounding medications in workers' comp. The other point I wanted to make is formularies are not a new concept. As previously mentioned, Medicaid, Medicare, group health, all utilize formularies. Prescribers are very familiar with their use. In addition, workers' comp in Pennsylvania is already using formularies. There are formularies being used in Pennsylvania already. What this bill will do, though, Senate Bill 936, is going to ensure the medications and treatments are safe and effective, that they're based on medical and scientific evidence. There's a consistent rule set that we apply throughout the process, and provide a process for exceptions. So it's important to note that formularies are guidelines only. They are not absolute. There are many drugs out there that may not be on the formulary that may be appropriate for injured workers, and those should be examined to make sure they're safe and effective before they're utilized. So with that, I will introduce Bob Carl, President of the Schuylkill County Chamber of Commerce, also a pharmacist.
Thank you.
Thank you, Doctor.
Thank you so much, Doctor. Representative Speaker of the House, Mike Turzai, thank you so much for having us here today. This is a critical issue for Pennsylvania. It's a critical issue for our nation. And I am so happy that the House of Representatives is tackling this issue here in Pennsylvania. I represent today 74 chambers of commerce across this Commonwealth who have signed a letter talking to the House and the Senate here in Pennsylvania about the importance of this issue, that we have to show the leadership that Speaker Mike Turzai and the other members of the House of Representatives have shown by addressing this through legislation. There's many aspects to this, but today we're talking about workers' compensation issues, and it's so important for the business community represented by our chambers of commerce who deal with our businesses every day and who cannot survive and thrive in our economy and make Pennsylvania great without employees that are not addicted to opiates. The sad part of this situation is sometimes we start off having to treat employees who require workers' compensation care, and we wind up with addicted individuals who unfortunately sometimes are addicted for the rest of their lives. Obviously not a consequence that is favorable to our business community and not a consequence that is favorable to our economy. An addicted person obviously cannot work in a relatively productive manner. So we need to take this situation very seriously. As the doctor just said, formularies are not unusual in Pennsylvania. They're not unusual across our great nation. As a registered pharmacist, which I am in the state of Pennsylvania, I can tell you, whether it be in hospitals or for any area of care, formularies are actually standard practice procedures to make sure that drugs of choice are used for patients in their care. Today, we need to put Pennsylvania where it belongs. We need to make sure that for the health and welfare of our business community, the health and welfare of our employees, that we follow other states. We already know that this is not pie in the sky. Ohio has great statistical evidence that this has worked. New York and California, two of the high opiate users, already have established these formularies in 2015 and 2017. It is time for Pennsylvania to follow suit and do what is right for chambers of commerce and our businesses and the employees, most importantly, the most important asset they represent, their employees, to do the right thing and make sure that medical treatment of workers' compensation cases are handled appropriately, with compassion, with great medical care, but at the same time, with appropriate treatment will lead to the desired result, getting our people back to work, not into an addicted state. I thank the House of Representatives and the Senate of Pennsylvania for addressing this aspect of this important crisis. And again, Speaker Terzai, thank you so much for helping us lead this charge.
Good afternoon. I'm Rob Kauffman, Chair of the House Labor and Industry Committee. And as the speaker started today, my mind goes back in my 14th year here in the House of Representatives. And, you know, I hear time and time again where Pennsylvania is tops in all the wrong categories. And as the speaker spoke this morning, I was reminded of that, where we are tops in the wrong categories in this workers' compensation system. And I want to repeat some of the things that I believe the speaker said. The second highest amount of opioids prescribed per injured worker. The second highest number of opioid pills per prescription per claim. And it goes on and on. And that is something that we need to change. You know, very few times would you hear me say that we need to follow Governor Jerry Brown and Governor Andrew Cuomo. But these are, I mean, let's get real. These are liberal blue state governors who didn't think that this was a cruel thing to do to workers. And we need to follow in the footsteps of some of those states, as well as blue and red states across the country who are implementing these systems. You know, the workers' compensation system is meant to get folks back in the workforce. That is what it's about. That's what the workers want. That's what the businesses want. They want someone back in the system and working. And as folks talk about how they're concerned about the proliferation of opioids in the Commonwealth, why is our injured worker any less? Why should we not care about our injured workers just as much as we care about anyone else on the street? When the CHIP program in Pennsylvania uses formularies, why should they be any different than an injured worker in the Commonwealth? And yes, you know, folks say, well, this isn't just about opioids. No, there are many things that are addressed in this bill. We are focusing on opioids, but it also, I mean, there are anti-anxiety medications, muscle relaxants, and of course the non-FDA approved compound medications that all need to have the speed bump, the guide rail, and that's what this is. These formularies are not hard and fast. They are a speed bump. They are a guardrail for those who are in our workers' compensation system. So with that, today we passed Senate Bill 936, which is the companion to Representative McKenzie's House Bill 18 today out of the House Labor and Industry Committee, 15 to 11, and we're going to keep on crusading until this is passed and moves on to the governor. Thank you. Mr. Speaker.
We have many members here, including our Majority Leader, Dave Reed, our Appropriations Chair, Stan Saylor, our Majority Whip, Brian Cutler, our Majority Caucus Secretary, Donna Oberlander, our Majority Caucus Administrator, Kurt Mosser, I believe our Majority Policy Chair, Carrie Benninghoff, and we are so appreciative that our entire leadership team has been here, as well as many members of our caucus. Two individuals I would love to cite. Oh, and Representative Marcy Topol, our Majority Caucus Chair, is here as well. Marcy Topol from Montgomery County. I had not seen Marcy, I apologize. Carlos Luna of the Reed Group, would you please wave your hand, Carlos? And Brian Allen of Mitchell, of the Mitchell Company. These are companies that help to make sure that these formularies are designed to be effective in reducing opioid usage and other medication usage. Brian was telling me prior that he's had loss in his own family with respect to the opioid crisis, and that, as we all know, to lose an individual to this opioid crisis is a tragedy, but also think of all the pain that it causes to the people that love that person. This is an opportunity. My colleague Ryan McKenzie, our champion, said, you know, it's one more step in making it better for the citizens of Pennsylvania. And also, we want to give people the dignity of work. We want them to get back into the workforce, family-sustaining jobs, drives an economy, and good communities and schools. With that, we'll take any questions. We'll take any questions that anybody has. Ryan and Rob will lead those questions because they know this inside and out, and maybe some of the experts behind us. Rob and Ryan, please.
What's that? Anybody?
Are you hoping that opioids are removed from the list?
So I will repeat the question. The question from the gentleman was, are you hoping that opioids will be removed from the list? And so a drug formulary does not remove opioids entirely from the process. There are cases where an opioid would be medically effective for an injured worker. What this does is, as somebody, Chairman Kauffman, I think, used the term guardrails. And so what it does is it puts in place a list of options which a medical professional, again, the drug formulary is created by medical professionals, and then the treating physician will look at that list. There will be evidence to support the types of medications which are necessary or approved, and those are then recommended. Oftentimes what we find is opioids are not recommended for a typical type of injury. And so you can see that in the statistics that I referenced, that the typical opioid usage in non-surgical cases has come down in Texas by 60 to 70%. So there are still certainly cases where an opioid would be necessary, would be effective for an injured worker. So you're not going to eliminate them entirely, but you will significantly reduce the overprescribing that's going on.
Thank you so much, everybody. We very much
Thank you.
appreciate it. Thank you so much.